1. Heroin. Heroin hits your brain and floods it with a feeling most users describe as pure warmth, total relief from pain, physical and emotional. Here's why. Heroin converts to morphine in your brain and binds to opioid receptors, the same ones your body uses for natural pain relief. It just floods them way harder than your body ever would on its own. The scientific catch is tolerance. Your brain adapts fast, meaning it takes more and more to get the same effect, while the risk of overdose climbs right alongside it. There's no real upside here. The drawbacks are severe. Slowed breathing, addiction that rewires the brain's reward system, and one of the highest overdose death rates of any drug in America. Interesting fact, heroin was originally sold over the counter in the 1890s as a cough suppressant, marketed as a safer alternative to morphine. It was anything but. If you or someone you know is struggling with opioid use, the SAMHSA National Helpline, 1-800-662-4357, is free, confidential, and available 24/7. That drug works by mimicking your body's own chemistry. This next one hijacks a completely different system. 2. Cocaine. Cocaine creates a rush of energy and confidence that can feel almost superhuman for about 20 minutes. It works by blocking the reabsorption of dopamine in your brain, the chemical tied to pleasure and reward. Normally, dopamine gets recycled quickly. Cocaine jams that process, so it just builds up. That flood feels incredible in the moment, which is exactly the problem. Your brain remembers it and starts craving it hard, fast. The drawbacks are steep: spiked heart rate, elevated blood pressure, and real cardiovascular risk, even in young, healthy users. Addiction potential is high because of how quickly tolerance builds. Interesting fact, cocaine was once an ingredient in the original Coca-Cola recipe before it was removed in 1903. Next up is a drug that works almost like cocaine's opposite. Instead of speeding you up, it pulls you down. 3. Alcohol. Alcohol is the most socially accepted drug on this list, and also one of the most dangerous when misused. It's a central nervous system depressant. It slows down communication between brain cells, which is why speech slurs, reflexes dull, and judgment fades after a few drinks. In small amounts, it lowers inhibitions and can relax you. In larger amounts, it starts shutting down critical brain functions, including, in extreme cases, the ones that control breathing. Long-term heavy use damages the liver, raises cancer risk, and can permanently alter brain structure and memory. Interesting fact, alcohol is one of the few drugs where withdrawal can actually be fatal, which is why heavy long-term drinkers need medical supervision to quit safely, from a legal drug to one still fighting for legal status across the country. 4. Marijuana. Cannabis. Marijuana relaxes some people and makes others intensely paranoid. The same drug, wildly different reactions. That's because THC, its main psychoactive compound, binds to cannabinoid receptors spread throughout your brain, affecting mood, memory, appetite, and perception all at once. The benefits are real in some contexts. It's used medically for chronic pain, nausea, and certain seizure disorders. The drawbacks include impaired short-term memory, slowed reaction time, and for some people, especially with high THC products, increased anxiety or paranoia. Interesting fact, the human brain has its own natural cannabinoid system, producing chemicals similar to THC. It's why the drug affects us so specifically. Now to a drug so common, most people don't even think of it as one. 5. Caffeine. You already know this drug. You probably had it this morning. Caffeine blocks adenosine, a brain chemical that builds up throughout the day and makes you feel tired. Block it, and your brain simply doesn't register fatigue the same way. In moderate amounts, it boosts alertness and focus, genuinely useful. In excess, it causes jitters, anxiety, and a racing heart. Interesting fact, caffeine is the most widely used psychoactive substance on the planet, and most people use it daily without ever thinking of it as a drug at all, from the mildest stimulant on this list to one of the strongest. 6. Methamphetamine. Meth triggers a dopamine flood so extreme that natural rewards, food, relationships, hobbies, can start to feel pointless by comparison. It works similarly to cocaine, but lasts far longer and hits far harder, releasing massive amounts of dopamine while also damaging the neurons that produce and regulate it. There's no meaningful benefit. The drawbacks are brutal: severe dental damage, skin sores, dramatic weight loss, and long-term cognitive impairment from actual brain cell damage. Interesting fact, brain imaging studies show meth use can cause measurable damage to areas involved in emotion and memory, some of which improves after prolonged abstinence, but not always fully. Next, a drug that alters reality itself rather than just your energy or mood. 7. LSD doesn't just change how you feel. It can change what you perceive as real. It works on serotonin receptors, disrupting the brain's normal filtering system so that sensory information gets processed in unusual, often intensified ways. Colors, sounds, and thoughts can all blend together. It's non-addictive in the traditional sense. Your brain doesn't crave it the way it craves opioids or stimulants. But the drawbacks include unpredictable psychological effects and, in rare cases, triggering underlying mental health conditions. Interesting fact, an LSD trip can last up to 12 hours, far longer than most other psychoactive drugs because of how tightly it binds to serotonin receptors. From a drug that expands perception to one that shuts the brain down entirely. 8. Benzodiazepines. If you've ever taken something like Xanax or Valium, you've felt this drug's calming effect firsthand. Benzodiazepines boost the effects of GABA, your brain's main calm-down chemical. More GABA activity means less anxiety, less muscle tension, and easier sleep. They're genuinely useful for short-term anxiety or seizure management. The drawback is dependency. Your brain adjusts to the boosted GABA activity, and stopping suddenly can cause dangerous withdrawal, including seizures. Interesting fact, combining benzodiazepines with alcohol or opioids is especially dangerous because all three depress breathing through overlapping pathways in the brain. Now to a drug most people associate with parties, but with effects that go far deeper than energy. 9. MDMA. Ecstasy. MDMA creates an intense sense of emotional closeness and empathy, which is exactly why it's being studied for therapy, not just nightlife. It floods the brain with serotonin, dopamine, and oxytocin all at once, a combination that boosts mood, emotional connection, and sensory perception simultaneously. Interestingly, MDMA is currently being researched as a potential treatment for PTSD under strict clinical settings, a rare case of a party drug crossing into medicine. The drawbacks include overheating, dehydration, and a rough emotional come-down days later as your brain works to replenish the serotonin it just burned through. Interesting fact, that come-down happens because your brain temporarily runs low on serotonin after the flood, which is part of why the days after can feel emotionally flat, from a drug that boosts connection to one that dulls sensation entirely. 10. Ketamine. Originally developed as a surgical anesthetic, ketamine creates a dissociative effect, a feeling of being disconnected from your own body. It blocks NMDA receptors, which play a major role in how your brain processes pain and consciousness. Block them, and the result is a strange, floaty detachment from physical sensation. Here's the surprising twist. In low, medically supervised doses, ketamine is now FDA approved for treatment-resistant depression, working faster than traditional antidepressants for some patients. Recreationally, the drawbacks include impaired coordination, memory issues, and at higher doses, a complete disconnection from surroundings, sometimes called a K-hole. Interesting fact, ketamine's antidepressant effects can appear within hours compared to the weeks typical antidepressants usually take. From an anesthetic turned antidepressant to a drug that's been legal and everywhere for over a century. 11. Nicotine. Nicotine hooks the brain faster than almost any other drug on this list, sometimes after just a handful of uses. It binds to acetylcholine receptors, triggering a quick dopamine release that creates a brief sense of focus and calm, which fades within minutes, prompting the urge for another dose. That fast on-off cycle is exactly what makes it so addictive. Your brain gets a hit, loses it quickly, and craves the next one almost immediately. The drawbacks are well documented: cardiovascular strain, and when delivered through smoking, direct damage to the lungs and dramatically increased cancer risk. Interesting fact, nicotine itself isn't what causes cancer. It's the thousands of other chemicals released when tobacco burns. Nicotine is the addictive part, combustion is the deadly part. Last on the list is a drug so common in medicine that most people don't realize how easily it can be misused. 12. Opioid painkillers, prescription opioids. These are heroin's legal cousins, and chemically, they're not that different. Drugs like oxycodone and hydrocodone work on the same opioid receptors as heroin, just often in more controlled, measured doses when prescribed appropriately. Medically, they're genuinely effective for managing severe pain, especially after surgery or serious injury. The drawback is the same one that fuels the opioid crisis. The line between medical use and dependency can blur fast, especially with extended use, and tolerance builds the same way it does with heroin. Interesting fact, a significant portion of heroin users report starting with a legitimate prescription painkiller before transitioning to street opioids once prescriptions ran out. 12 drugs. 12 completely different ways of hijacking your brain's chemistry. Understanding how they work isn't just interesting. It's the first step in understanding why they're so hard to walk away from. If you found this eye-opening, hit subscribe to Rx.Cologist, because knowing what's happening inside your body is always better than guessing.